In this podcast, we will finish up Chapter 8 with Part 4. And primarily, we're going to be looking at the review exercises that are found at the end of Chapter 8. I suggest, as we go through these slides, that you would attempt to answer your CPT codes before advancing through the slides, just to be sure that you have the practice of finding these answers. A 30-year-old male is given a subcutaneous injection of a live varicella virus vaccine by the nurse practitioner. Well, you've got a vaccine, so you know you're going to have to code for the vaccine substance itself as well as for the administration of the injection. And there are your two codes. MDI, or metered dose inhaler, treatment for a patient with asthma. You would have inhalation treatment as your main term, airway obstruction, pressurized or non-pressurized, to give you 94640. Physician treats plaque psoriasis of arms and legs with the use of laser. There is a section in this chapter called Special Dermatological Procedures, and it talks about treatment for various dermatology conditions, and one is the psoriasis. It does look at the body surface area. Our example gives us 250 square centimeters. Psoriasis treatment gives you this range of codes, but when you look at the codes, they are differentiated by the method of treatment, which in our case is laser, and the surface area. Code 96921 is for surface area 250 square centimeters to 500 square centimeters, so that's the one that we select. An IV chemotherapy infusion lasting 3 hours. The infusion is here. When we start reading our code descriptions, code 96413 states up to 1 hour, single or initial substance. And then 96415 is each additional hour. So we would list 96415 2 times to account for the remaining 2 hours. Exercise review number 10 is speech audiometry with threshold and recognition, both ears. Your index pathway, it falls under an audiologic function test. Audiometry, when you see that METRY, that means measurement, so you know it's some type of test. You know you're doing something with the ears, so I think audiologic would come to mind pretty quickly. So then you just follow your subterms until you get to audiometry and speech. You look up our code descriptions, and 92555 is speech audiometry threshold. 92556 includes the speech recognition, so we want the 92556 as our answer. The guidelines at the beginning of this section tell us that all services include the testing of both ears. You must read your guidelines to find that. To me, that should be bolded, but it's not, so it's highlighted in my book. So because all services include testing of both ears, you do not need a 50 modifier. The next exercise, a pharmacist spends 30 minutes providing medication therapy management services to an established patient. The medication therapy management would be our main term, and pharmacist provided subterm. We read those code descriptions, and 99606 is the initial 15 minutes with an established patient, and 99607 is each additional 15 minutes. Remember that when you're providing medication therapy management services, the fact that it's a new or established patient is significant, as well as the amount of time being spent with the patient. Leg prosthetic training for 30 minutes by a physical therapist. Prosthesis training is actually the main term in the index. 97761 is for each 15 minutes, so the code would be listed twice to account for those 30 minutes. Comprehensive ophthalmologic services provided to an established patient with extended color vision examination. The guidelines at the beginning of this section tell us that extended color vision examination goes beyond the services included under general services, therefore it would be coded separately. We add the modifier 25 to 92014 to explain that additional services were added. So there's your rationale for why you would add that 25 modifier to your exam, and then how you would code the color vision exam. Complete duplex scan of the lower extremity arteries bilateral. Duplex scan is the main term found in the index. And there's your subterms. And you know that when you read the code description for 93925, the term bilateral is included in that code description. Therefore, modifier 50 is not needed. Individual interactive psychotherapy for 37 minutes provided in an outpatient setting. Psychotherapy is your main term, individual patient, giving you 90832. The CPT guidelines tell us to choose the code closest to the actual time. So we don't have a code for 37 minutes, but we do have a code for 30 minutes, and that's the code we selected, 90832. These guidelines are found under the section Psychotherapy. Here's an example not in the CPT textbook for one that you will see on an exam or something similar to it. We didn't talk about EMGs, which are just electromyographies of various nerves. This particular scenario is what is the correct code assignment for bilateral EMG of cranial nerves. Electromyography is the main term, needle, cranial nerve supplied muscle. We have two terms there. Start again. We have two codes there. The code description for 95868 includes bilateral, so we don't need the modifier 50. 95867 includes unilateral, but since there is a CPT code for bilateral, we're going to use 95867. So again, pointing out the importance of reading those code descriptions. Here's an example not in your CPT textbook. It is an exam question or one similar to it. Patient receives a 30-minute IV infusion of 2 grams of Rocephin. Rocephin is a very strong antibiotic. A J code would be added for the Rocephin. And there is your intravenous infusion, therapeutic, because it is an antibiotic. Intravenous infusion is your main term, therapeutic. When you look at those code ranges, the description for 96365 states up to 1 hour. So it would be appropriate for a 30-minute infusion of a single substance. So we select 96365. If you have any question about the Chapter 8 review exercises, please post them in the discussion board and I will answer them. Please include the path you use to try and find the code. This has been a long chapter and it covers a lot of things. But I've tried to help you along by letting you know the types of questions that are going to be on the exam so you can do better. This particular exam will be for medicine chapter anesthesia, which is a slightly smaller chapter, so it's just as much content, but it's only 2 chapters on this exam. Thank you so much for your attention. I know this is a lot of detail, and I hope you have a good day.